Yeah, coming from a point of view of a concerned citizen. Now, there's something that is happening recently and it's getting people worried. And that is the issue of this snake bites. It's everywhere now. So many people have seen snakes in their houses. Some people have killed snakes in their underbeds, in their toilets, and every other place. Now, people are asking why and what are they supposed to do when a snake bites them? Now, there are some immediate things you do. And I want to say something before I continue. Snakes are not just found anywhere. They are looking for a place because there is hotness everywhere. They are looking for where there is cool. And when there is hotness, they go for houses. They stay near the houses when the weather is cold and everywhere is cool. They stay outside. Immediately the weather starts getting hot. Snakes will start looking for where there is coolness, where they can stay. They can go into the houses, inside the toilets, and anywhere there is coolness. And that's why they enter the people's house. Another thing that brings them in is rodents, all these rats. Where there are rats and all those small things, the small animals they can eat. They come in. Then they can also come in by egg. If they see eggs or eggshells around the house, you see, they like egg a lot. And they see egg around the house, they come in. So these are the things that you know that may attract them. When you see rats all over your place and you see all those small rodents all around you, you know that they may come. And you have chicken, you keep fowls or small chicken, small fowls inside your house. They come in because they are looking for all those things. They look for egg. So these are the things that attract them. Now, there are many types of snakes. I will still go into that in my second video. There are so many types of snakes, and how dangerous they are is different. They have different grades of being, different grades of, being bad. They are not, all of them are not the same case. Some of them are more dangerous than others. Their venom is different. So now, when a snake bites a person, so many people don't know what to do, and that is what gives the snake a venom power to harm the people. Now we know that snake bite is dangerous. That fear, that panic is the first thing that you have to deal with. When a snake bites you, don't panic. Once you start panicking, you start doing a lot of things, and that movement activity at that particular point in time increases the spread of the venom. And the spread, determines the outcome. The rate of spread determines the outcome. Some people don't know this. That's one thing. Then another thing is that the type of snake is very important. If a snake bites you and you have the chance to take the picture of the snake, it's good so that the hospital staff can know what to do and then know the type of snake that bites you. And you don't need to stay in that environment. Immediately a snake bites you, shift. And if you're in a safe distance, you can take a picture. Or you can look at it and you can describe it when you get to the hospital. Very important. Now, getting to your action. Once the snake bites you, the first thing you do is to be calm. The more calm you remain, the more the spread is delayed. And the delay of spread of the venom is very important. Because if it spreads rapidly, some of them are so rapid, under 20 minutes, the person is gone. 30 minutes, the person is gone. Depending on how dangerous the type of snake is. Now, when you have gotten this thing, you have gotten yourself and you are calm, you now do a kind of, demobilize that place. Don't move that place that is the snake bites you. If it's their leg, you just keep it calm. Don't move it again. And don't move so much. Don't trek. Don't do anything. That leg should not be moved. And then don't, lift it. The most important is that whatever part of the body that snake is beating will be below the heart level. Because most of the time, the venom goes straight to the heart and causes anaphylactic shock. Some people have anaphylactic shock and they go. So now you keep it demobilized. Call the doctor. If you have a phone number of a doctor, that is good to have a doctor's number. So that before you get to the hospital, the doctor is ready for you. Then move straight to the hospital. The area you get to the hospital, the better. Do you know one thing I want to tell you? Snake bites don't do much harm if you get to the hospital on time. That's an information I have to give you today. Snake venom don't do much if you get to the hospital on time. Don't tie so much this thing. Don't tie anything so much to make it your leg start having problem. Or stop cutting it. Don't cut. Because the more you cut it, the more you allow the thing to go into your system. Don't cut. Don't tie. And then don't do sucking of the thing venom. Stop doing all those things, because by the time you do those things, you are allowing the venom to get into your system, and you are making more, having more and more delays. Then when you get to the hospital, anti-snake venom works. People don't know that it works. Anti-snake venom works like magic. I have used it many times and I have seen good results. Very, very effective. Once you give the person anti-snake venom, the venom goes down and the person gets himself. So the most important thing is to get the person to the hospital on time. Once you get the person to the hospital on time, the person recovers. And then you now describe the type of snake so that the doctors can evaluate and know what to do further. And there are some steps the doctor will take to get you back to normal. Please, don't panic. Don't move. Don't move that part of the body that is beaten. Don't cut that place. If you can do anything, you just use maybe the tool or any of those antiseptics, and just wash that place, or use salt and water. Just wash the place and keep it clean, and then go to the hospital. Make sure you go to the hospital within 10-20 minutes of being bitten by a snake, and make sure you have a doctor that you can always call, so that they get ready for you, because at times the anti-snake venom may not be in the hospital, because of most of the times when you store the anti-snake venom, it's not something that happens every day. It expires in your hand. So most hospitals don't spoil it. But it's good that every hospital should have it. So as I always say, people, the more knowledge of your health you have, the healthier you live. We'll talk about other things like dog bites and all those things, rabies and the rest of them in our subsequent videos. Thank you.